I think what the Access to Medicines Foundation has managed to do very successfully is really supporting the industry in driving their access policies towards those that can have the greatest impact on health indicators. And so very much highlighting the best practices, really flagging when certain policies have been successful and what they've achieved. And all that is trying to create, I think, a race to the top. So very much trying to incentivize and influence in a positive manner the way the pharmaceutical industry engages with access in low and middle income countries.
Indexes that the foundation works on is a sort of a competition. It creates an environment whereby you want to do better and you want to do more. It's a driver for health equity, it's a driver for positive change in the therapeutic landscape, and it's a driver to save lives, bottom line.
It's impossible to talk about universal access if neglected populations are left behind. So bringing the pharma industry, the pharma sector, to work for those neglected populations, having the support of the Access to Medicine Foundation to keep the momentum and to keep the motivation of this sector with us, it's key not only for DNDi but for the global health community to achieve universal health coverage.
So Access to Medicine Foundation makes a huge difference in terms of furthering the agenda of accessibility to medicines by working with the pharmaceutical companies and pushing them to do more and evaluating what they are doing and quantifying that, which is a very important parameter in furthering access.
For us, the Access to Medicines Foundation has been really crucial in understanding what needs to change in the insulin space and diabetes care overall. The Access to Medicines Foundation Index reports on insulin access and convenings with our partners have been really crucial in understanding where our partners, particularly the private sector, doing really successful things that are impacting people, and where could they be doing more? And I think most importantly, where can other stakeholders in the global health space make sure that those private sector partners are empowered and others are taking up their share of the effort so that we can really fix this unacceptable status quo.
I think Access to Medicine Foundation is unique because it is coming at the problem from a number of different angles. From the one side, working with the companies to say, what are your difficulties, what are the constraints? It's also coming from the community aspect, from civil society's point of view, from the provider's point of view, to say what is needed, where are the gaps, and it's bringing evidence to the picture. And by, I think, coming at it from more than one angle, we really do begin to see solutions to the problems.